This is Nursing Uncensored. I'm your host, Adrianne Benning, and I invite you to listen in on conversations I've had with real nurses about the crazy and wonderful lives we lead. This podcast is meant to create laughter in addition to serious discussion, and nothing is off limits. We're always honest, but we're not always safe for work. Please listen responsibly. Welcome to Nursing Uncensored. I am your nurse host, Adrianne, and today we are doing an episode that is kind of going along with this important theme of inclusion and minimizing healthcare disparities for populations that experience a lot of healthcare disparities. So today I am happy to introduce social worker, author, ally, and advocate Jeannie Gainsburg. Welcome to the show, Jeannie.
Hi, thank you for having me. I'm thrilled to be here.
I'm happy to have you. This is such an important topic and conversation, and it's one that's near and dear to my heart because ever since I was a repressed Catholic high school student, I've had friends in the LGBTQ community, and when it was uncool and kids are making fun of other kids, I remember being the person that was like, leave my friend alone. So I'd like to continue what I started as a kid and welcome you to talk about all sorts of things. We're going to cover a lot today, but I would love to start out hearing more about you and what you do and your journey that brought you to what you do now.
Sure, thank you.
Yeah, of course.
So I'm a straight and cisgender ally to the LGBTQ plus communities. My pronouns are she, her, and hers. And I'll share that, Adrianne, you got to start way earlier than I did at being an ally. So as a kid, I like LGBTQ plus inclusion was always just like a no-brainer to me. Like I didn't understand why people got their knickers in a knot over it, but I was not an ally, and I wasn't really the kind of kid who would really speak out or stand up. I was very, very shy. And I didn't actually become an active ally until I was in my 40s. So kind of a 40, actually, to be exact, a late bloomer. So
but
I knew no one
now.
I am.
Yeah.
But it's an interesting, slow journey. Actually, part of the issue was that I didn't have anyone in my family who identified as LGBTQ plus. And I didn't have any friends who were out. So, as it turns out, of course, I had many LGBTQ plus friends through my elementary and through high school, but I didn't know that because I didn't feel safe being authentic. I graduated from high school in 1981, if that gives you some perspective of what year we're talking about. But I also, because of that, because I didn't have a connection to the communities, I really didn't know if I'd be welcome there. And I also didn't really know that there was a role for me. So the word ally was not really out there within social justice movements in the 80s or even really 90s. So I got a really slow start. I always felt like this was important, but I never did anything about it. And then in 2003, I was actually a stay-at-home mom. My background previously had been in women's reproductive health and working with pregnant teens in Philadelphia. And So I quit that to stay at home with my little ones. So I actually was at home, and it was at 2003 brought the point where they were just both starting school. So my little one was starting kindergarten and my older one was in elementary school. And a lot of things were coming together for me at the time that was making me sort of rethink about LGBTQ plus inclusion. Partly, interestingly, you also said, Adrianne, that the kids used to tease kids. Well, it's still happening. And one of the things that really, to me, was one of those moments where I felt like I needed to get involved, was that I was listening to what my son was coming home sharing with me about what the kids were teasing each other about. And I'm like, really? We're still there? Come on, So, but I really did have a big aha moment. I was in bed one night. My husband had given me a book for my 40th birthday called Not for Ourselves Alone, which is about the women's suffragette movement. And I'm reading that book, and I was doing the thing that I do when I read history, which is putting myself back in that time and thinking, how would I have behaved if I'd lived back then? And I had convinced myself that I would be marching alongside all those amazing women. And it suddenly hit me that I was being very hypocritical, that I've felt strongly about LGBTQ plus inclusion my whole life, and I hadn't done anything about it. So the next morning I found our local center, which I didn't know existed, our local LGBTQ plus center here in Rochester, New York. And I called and asked if I could volunteer. So that was 2003. I volunteered for about 2.5 years, and then was hired as staff as outreach and education coordinator. And then several years later was promoted to education director. And I ended up staying on in that role for about 15 years and learned a ton. And when I, sort of realized it was time to move on from that, I had such good stuff in my head that I was like, I need to get this out there in a book. And so, so I wrote the book. It's called The Savvy Ally. Ta-da! There we go. Even better. You can actually see all the letters.
Yes.
Wrote my book in March, launched it March 12th, if you can picture that, like perfect time to launch a book. Everything immediately shut down. I never even had my book launch. It was a bummer. But I know we're going to talk a little bit about the book later, but that was sort of the motivation, was that for people like me who were starting, like knowing nothing, I knew nothing about the LGBTQ plus communities. I wanted to make a guidebook that was really easy to understand and fun and encouraging. And so, I wrapped all that up into a book, and hopefully people, if you like my style and my content, hopefully people will check it out.
Excellent. And I do want to say, we are going to talk about the book, but I just want to say to start out that this really is a great guidebook, because here's the thing. We can have these conversations. Let me start over. I really think it's important that we are having these conversations, we as in cis hetero individuals, because people that are in the LGBTQ community, they already know what the problems are. They're already struggling. This isn't new news to them. So it's really great that we're having this conversation, and that people are able to not just open their minds to the fact that there are people different than you, and it doesn't hurt you, and it's okay, and everybody's going to be fine. But really, that literacy is so important. And one of the things that I said to you in the email after I got the book was, I love a book with a glossary. I really do, because language is so important, especially when we're talking about not just with the LGBTQ community, but with any intersectional communities, any intersections. We need to know what we're talking about, because it's not just all one big soup of melted ice cream. There are super important differences within the community. Just like we were talking about before I started recording, the transgender community, I'd like to talk about a little bit more thoroughly as well, because that's a whole different set of challenges and considerations and needs for that community. So we're going to do our best today to be as inclusive and helpful as possible as a general topic, but by no means is this like the end all be all, everything you need to know. But this is to kind of wet the lips of people who don't know much, so that you can do more self-education, including getting the book. So first, I would love to talk about, to kind of set the stage here and talk about a little bit more about why we need allyship with the LGBTQA community. So would you talk a little bit about that? Why is this even important to talk about?
Sure, yeah. And actually, I'm going to talk about, I can talk about it on a lot of different levels, but I'm going to really focus in on nursing, like healthcare.
That's
Let's just
perfect.
make it really relevant. So, I think the LGBTQ plus communities bring a unique set of challenges to healthcare and to the health relationship with health professionals. One of the things that is unique to LGBTQ plus folks is that often they can be invisible. So they actually are, in many ways, and especially when they move into a healthcare setting, when they're already feeling probably really vulnerable. I think nurses unfortunately get most of us at our most vulnerable, because we're, about to go into surgery, or we've got some medical condition that we're nervous about or whatever. But, this added layer of, am I safe to come out here? The idea of coming out, I just want to say, coming out is like a lifelong journey. Because we have these expectations that everybody is straight and cisgender. So like my journey isn't a lifelong journey of coming out, because people make assumptions about me and they're right.
And the world is kind of built with you as the default.
Right, exactly.
So yeah.
fit those boxes. Absolutely.
Yeah.
So LGBTQ plus people don't fit those boxes, and there's a lot of expectations that are made of them that are not true. So they have to look around their environment or hear the language that people are using and decide, is this safe for me to come out or not? And if they choose that if they decide it's not okay, I don't feel safe coming out here for whatever reason, they're not going to get quality health care because they're not being authentic. They're not telling you enough about maybe even literally their bodies if they're trans. Maybe they're not sharing who they consider family, right? Maybe they're, or who their spouse is, or so to me, I really wanted to kind of focus today, not so heavily on, the glossary, like, absolutely, it's a great reference. But I don't focus heavily on the glossary because I don't think, I like it as a resource. I don't think you should memorize that. I think there are some really easy tips that people can do to create those environments where LGBTQ plus people come in, look around, and decide maybe it's okay for me to be authentic, either in this space or with this particular nurse, because they're giving me indications that it's okay for me to come out. And so I think focusing on those today is going to be probably the most bang for your buck in a podcast.
Yeah, absolutely.
If that makes sense. So that's really why it's important. I'll just say one more thing about, allyship and the challenges that LGBTQ plus folks face is that historically, and of course this is not across the board, but historically LGBTQ plus people have faced some real serious barriers to care. They've had some horrendous abuse against them, and we're actually even today still living in a time when it's perfectly legal for someone to refuse care because it goes against their religious beliefs. So how is that instilling trust in in healthcare?
Yeah. And when I was 18 and I grew up near Chicago and I moved to Iowa City, which is 4 hours west of Chicago. And here we have a women's healthcare clinic called the Emma Goldman Clinic. And I worked there from the ages of like 18 till I was like maybe 21 or 22. I can't remember. But we every year or twice a year, it started out, so this was back in like the late 90s. So it started out, we called it Lesbian Health Night, and eventually expanded it to include the entire queer community. But we did a night that was billed just for them because of the stigma and the abuse that people have experienced at the hands of healthcare providers, whether it be intentional or ignorant. But we used to have these healthcare nights that were free of charge for the healthcare they needed and was branded for them so that there was that automatic recognition of safety. Like, this night is for you. But also, it's unfortunate because a lot of LGBTQ community members don't have access to health insurance. Maybe, they don't have spousal insurance everywhere like some of us do. In addition to being afraid to access healthcare, there's all sorts of stuff that goes along with even just having the ability to seek it. And not to mention that with the abuse and struggles that some people, and again, not across the board, not every person that is in this community has those issues. Many do. But then also thinking about just the act of, I think about what it's like when I walk into a doctor's office and the anxiety that I have. As someone that's been receiving healthcare, I've never been misgendered. I've never been told that what I'm doing is a phase or a sin or contrary to my provider's beliefs. I have all this privilege that until at the age of 18, I learned all of this because I was like, what do you mean they don't have access to healthcare the same? So as a very young woman, I was exposed to this world of people that are like, yeah, I was assaulted by a healthcare provider, or whether it be verbally, physically. There are things that I think a lot of cis hetero individuals don't realize are even possible. But it does happen, and like you said, it continues to happen. So we as healthcare providers, you as a social worker, me as a nurse, we need to make sure that we're doing as much as we can to reduce and dismantle these barriers, right? Big job, but each one of us can be an individual in this fight. So let's talk about a little bit more. So I've been blabbering on because I'm very excited about this topic, but I would love to hear you talk more about some of these challenges that people face and kind of what it means for what we should be doing as healthcare providers, like how we should be directing ourselves.
Sure. Yeah. I mean, I think, I think you touched on some of them. I mean, historically, people either they have, they know the history of, sort of abuses within the medical community, or they have experienced that themselves, or a friend has gone to this clinic and said, oh, they're really not, trans friendly or trans knowledgeable, word's going to get out. And again, this is the type of barrier that comes in, so that you're often not even, seeing the folks, like, so there's almost two conversations that have to happen, right? One is the, once they're in the door, how can we be inclusive in a way that will encourage them to come out and be authentic? But then there's actually the getting them in the door, because I think part of the problem is that a lot of LGBTQ plus folks delay the healthcare because they're so very nervous about going in. And that, again, that's sort of a different topic. I do want to stay focused on sort of what nurses can do to help. But, as far as, so along those lines, I mean, I think one of the problems is, and before we even get into this, I just want to say, look, I think nurses rock, and I am straight and cis, and I have had, like, across the board amazing experiences with nurses. I know that, you folks get into this career because you want to help people. Like, you are genuinely caring, amazing freaking people. So when I was actually sort of thinking about, coming into this podcast, I'm like, I just need to state that, because what I mostly have seen when I've done workshops for nurses is this incredible desire to do what's right, to do what's fair. But I'd say the biggest sort of like problematic thing that gets in the way is this sort of, the expectation gets put on the patients, if you will, to sort of help navigate. So I think it's hard for straight cis folks, again, to understand, like, how hard that is to come into a clinic as an LGBTQ plus folks. So I would often do presentations and people would say things like, well, I just asked the man about his wife, and he corrected me and said he had a husband, and it was no big deal, right? So from this perspective, it's no big deal because they just corrected me, when of course your language is implying that, there's something different about you. Otherwise, I would have used the word spouse. I've also heard people say, well, if trans folks would just call ahead and let us know that they're coming in and that they're trans, we will do all these sort of special accommodations. And again, I think that's sort of the reverse of what should be happening. I mean, it's a very unusual trans individual who would actually have the bravery, the strength to call ahead and say, look, I'm trans, here are some things that I need. Like, that's not how it should happen. And I think this all really comes about because nurses are freaking busy. I mean, you have so much on your plates. And I just want to acknowledge that. I think, a lot of the attitude is like, I've been doing this for years. I always do it this way. It's been working for me, and I'm exhausted, and I'm overworked, and I'm underpaid. And, to sort of add new things is really problematic. So I just want to put that out there and acknowledge that. And I think one of the things I want to say is that as we start to look at, like, what are some actual ways that we can change our language or behaviors, I think it's important for nurses to forgive themselves for not getting it all right tomorrow. Like, that's not how we learn, and that's not how we add new behaviors, right? I think the thing to do is, if you're kind of jazzed by what we're talking about here today, and you're like, yeah, I really do need to, do some of these ally tips, is to do it one at a time. Like, think of one that you just kind of do all the time and be like, ooh, that's an oops. I need to just focus on that one tweak. Just focus on that. And when you get that down, then pick another one. Try not to heap so much on your shoulders, because you can't. You're too busy as a people, as a community. So I just want to put that out there.
Absolutely. I think that's true. And, even the most empathetic, wonderful nurse, we're still people. We still have inherent biases. We're still brought up in a world that is just seething with stereotypes, and we kind of absorb these even if we don't intend to. So I think in addition to being gentle with ourselves and slow and really giving ourselves a chance to develop these good habits, we also have to just think about where these biases and thoughts are coming from. Is this something that you've been programmed to think, or is this a belief you actually have? And for a lot of us, it's just something we've been programmed to think. And
Yeah.
another thing that popped into mind, which I think is great for every single patient you see, regardless of who they are, is saying, how do you like to be addressed? I don't care if it's an 85-year-old cis hetero male or a 12-year-old, questioning trans kid. Just say, hey, what's important? What's most important to you in your care? I say that to people of different religions, of different cultural backgrounds, because here's the thing. We don't want to put the burden on them to say, well, actually, I need these things and this is special about me. We need to say, hey, I want to take really good care of you. What do I need to know about you? Because then you're not just giving them this awkward space to like maybe bring it up. You're saying, I am open to hear what you have to say to me. And that works with everybody. So I think that that's a thing that we don't even have to like think, is this a patient I need to use this technique with? Just use it with everybody. Mr. Smith, how do you like to be addressed? Oh, you like to be called buddy? Cool. Good to meet you, buddy. It works with everybody. So I just wanted to throw that out there because that has helped me in situations where I'm like, oh, I don't want to put them on the spot, but I want to address what I feel unsure about,
Yep. It's huge. It is absolutely huge. And I'll say, like, I love that you said it's for everybody. I mean, this is not just you walk into the room and you're like, ooh, I can't quite tell what pronoun this person uses. If you use it with everybody, first of all, it's so much smoother. You're used to asking, and it does help everyone. I mean, I hate being called Mrs. Gainsburg. I'm like, no, don't
call me ma'am. I'm like,
ma'am. Exactly. I'm the same way. No. Yeah. Anyway, so
and some people want to. Oh yeah, go ahead. Sorry.
No, please.
I was just gonna say some people want to be called Mrs. Rogers or.
Yep. And you don't know by looking at them.
Yeah,
you can't tell.
Never know. Nope.
So just one more thing I'm going to add to that is for those of you who are not used to asking people like, how may I refer to you? Or how would you like to be addressed? One of the ways that can make it a little bit easier is if you start by offering your own information first. Mm-hmm. So, hi, I'm Jeannie Gainsburg. Please feel free to call me Jeannie or Nurse Jeannie or like whatever. That just leads really beautifully into then asking them. And if you want, and again, this is sort of an additional level, you can say, my pronoun is she, after you introduce yourself, so that they may feel more comfortable asking, answering with their pronoun as well, which of course they don't have to. It's all optional. But so starting with your own stuff sometimes makes it easier for people to share.
Absolutely. That's a great tip. And actually, I don't usually do that. I'm going to start doing that.
Cool.
And then another thing, this is such a little detail, but I love this. So I wear my badge and, I have a couple of pins on it for infection control purposes. With all this Corona stuff, I've really eliminated a lot of the like bling I've got, but I did keep my medical ally pin. And I've had 2 people say to me, I like your pin. So I think that even if you're uncomfortable saying, hey, this and that, this is how I operate, a little pin, anything. And, some people, their hospitals are very picky about that kind of stuff. I've seen posts about people saying like, well, my hospital asked me to take it off because it's political. I don't think it's political. That's my personal belief. I think it's just how we handle individuals and human beings. But yeah, I love my little medical ally pin. I got it on Etsy. I wear it every day, every shift. So I think
visibility is so important.
Yeah. And if other people see it, even other cis hetero healthcare providers, then they say, oh, what does that mean? And then I have an opportunity to say, hey, let's have this quick little conversation, So yeah, and I think that art of conversation with our coworkers can feel, just like with our patients, it can feel kind of scary and it can feel uncomfortable. But we also need to be able to have these conversations with our coworkers and with our fellow nurses, support staff, other healthcare providers. So I don't want to jump too much, but I would love to talk about kind of how we can talk with our coworkers and then kind of bring it together together, like how we make those conversations happen and how we create kind of like an environment of safety and inclusion for every person that we see.
Sure. Yeah. So do you want to start with maybe some tips with talking with folks who maybe don't quite get it, or maybe
Yes.
are a little resistant, or just don't understand what the big deal is?
Yeah.
Yeah. So I actually, so in my book, I actually dedicate an entire chapter to this.
Mm-hmm.
And this goes like beyond LGBTQ plus. I mean, this is really just about how do we talk with people in today's world, of course, very divisive. People are not listening to each other. You know, how do we have conversations where people are really listening and being respectful and opening people's ears up for conversation rather than shutting people down and making them defensive? So
Mm-hmm.
I spent a chapter on this. So a few tips. The place I like to start is just by starting by understanding how people learn. So I don't know if you got to this chapter yet, but I talked
did.
about
That
how
was the first chapter I went to.
so we all have this like lump of knowledge. I call it our lump of knowledge in our head, and it's something that we have, created our whole lives, right? Basically, your whole life you're creating this lump of knowledge, and it's what you know. And I've got my air quotes here because it's what we think we know. Basically,
Mm-hmm.
it may be correct or it may be not correct, but it's what we know, and we've worked hard on that lump of knowledge. And so what that means is when a new piece of information is, offered to us, we are not going to just stick that new piece of information into our lump of knowledge and change it, because life would be chaos. Like, we worked hard on that lump of knowledge, and we created it over years of talking with people we trust and listening to our media sources that we trust and hearing from faith leaders and parents. So to get a new piece of information, you don't just stick it in your head and change, because life would be chaos, and that's not how you learn. So the reason I like to start with that is I think I often get the question in a workshop, for example, like, my uncle is so homophobic. Like, what can I say to him to change his mind? Like, I get this question all the time. And I'm like, the answer is like nothing. There's no one thing that you are going to say that's like this magic, perfectly crafted statement that is going to change this person's mind, because that's not how people learn.
Mm-hmm.
We slowly learn. It's a journey, and we learn when we have respectful conversations and we're able to like think about things and chew on things, and seeds are planted, and then we move down the line and maybe we hear more, and that's how we learn. And so in some ways it's a good thing, because it takes the pressure off people to come up with that magic statement, right? Because it doesn't exist. But also just realizing that the value of just having conversations, whether you've changed someone's mind or not. So I like to start there. And then my second activity that I like to do is to help people get into the right mode of having conversations by thinking about a time when they were in the hot seat as the learner. So probably every single one of us has at some point said something offensive, told a joke that somebody else found like a little bit off, or used an outdated term. What interventions have been made with you, and what has worked and what hasn't worked? Because mostly what we hear is that, especially if it's like kind of the first offense, if you will, like not someone who's just, we all probably have the friend who's like just it's like they're trying to push you up.
Yeah, there's something there. There's
not talking about that person. I'm talking about like someone who's like, you're like, oh, I'm a little surprised this came out of that person's mouth. How do we have that conversation? Well, typically it's respectful if you actually pull them aside and have a polite conversation away from other people, because you're going to embarrass them, and by calling them out in public if it's the first time you've heard something like this, right? So offer the respect that you would want. So for me, that's really helpful if people pull me aside. It's very helpful if people just explain to me sort of like a better term, like, oh, this is, maybe you didn't even realize it, but this term is kind of outdated. Maybe here's the history of this term. Here's a better term. It's just really respectful to do it that way. And then some of my other tips, again, along the lines of what's helpful, is connecting statements are absolutely huge. So what I mean by that is if it's something, getting on the same level as the person. So rather than let me educate you, because I'm up here and you're down here. I like the way my hand disappears in my anyway. I just realized
the power of green screen.
But rather than like, let me educate you. If in fact you've made the error yourself, that's a great way to start the conversation, right? Like if it's something like, oh my gosh, I used to say that's so gay all the time. And like, here's what I learned. That's getting on the same level as them. It's like, yeah, I was there. Like, I absolutely used to say that. And then sharing what you learned. So that's a tip that I love.
And it's
Assuming
actually,
goodwill. Go
that's
ahead.
literally a conversation I had like 2 days ago where a friend of mine was like, can you believe we used to say that as kids all the time? We just threw it around like nothing. And what a
Yeah.
different world we live in now as adults, that we've grown and we've learned that that our words do have power and can be hurtful. So anyway, sorry, I just wanted to
Yeah.
throw that in. I didn't mean
No, absolutely. Absolutely. Yeah, the assumption of goodwill, I just have to throw that one out there. It's the theme that runs throughout my book. And it basically is assuming that the person did not mean to intentionally be hurtful, that they maybe just didn't get the most updated memo,
to.
right? And I think the assumption of goodwill gets some bad press sometimes because people misunderstand it. So for me, it doesn't give people a pass to, use offensive terminology because they didn't mean it that way. It doesn't take the place of conversations. It sets the tone for the conversation, and it will take you so far. And again, when we do that, flip it, when I'm in the hot seat, I can't thank the person enough when they assume, they're like, hey, I know you probably didn't mean it this way, right? Like, thank you. I didn't. Like, I really appreciate
Yeah.
you understanding that I'm coming from a good place. So those are like some of the tips that I like to share as far as having those conversations. I thought of one more. I like to avoid labeling. So a lot of social justice folks say don't label the person, label the
Hmm.
behavior. So rather than saying like, what you like, you're homophobic or you're transphobic, say like what you said was. And I actually go one step further and say, don't label anything. I think you're going to go off on a tangent about why the comment was or wasn't transphobic or homophobic, because the person's going to feel really
Hmm.
defensive. Whereas if you just focused on the impact, then you're actually having the conversation that should happen, which is like, hey, this word is a little bit outdated. Here's a better one. You know what I mean? Really focus on like the impact that word has and some better choices rather than labeling it. I think that really gets us nowhere.
And I
Um,
also think, especially with nurses, we want to appeal to their empathy because, right, we care about people. Even if we're burned out and exhausted, we're here because ultimately we care about the person that we're seeing. And so I think that, what I've said in the past is kind of what you're saying, like, hey, I know you totally didn't mean it this way, but I actually think that kind of hurt his feelings. And so maybe like next time, maybe we could try using this approach, or maybe this word we should try to get at. But yeah, I never go up and say like, that was super homophobic and you should and
right.
you should stop saying that. No, because then immediately people are going to be like, uh and then they're immediately on the defensive, and when you're on the defensive, you're not going to learn anything, even by
Exactly.
way of like trickle. I think of like water eroding rock, like that's kind of how our um I don't want to say attack. That sounds so aggressive. That's kind of what our plan needs to be, to kind of, like you said, just slowly build these conversations. And over time, people will
Yeah.
hopefully be like, oh, yeah, we just talked about that. I shouldn't say that. Or I
Right.
should try to change how I use my language. So I think nurses are really receptive to that. Um, so yeah, like I said, I've had those conversations myself, and usually they turn out okay because the person doesn't mean to be offensive or hurtful or whatever. So yeah, I think that's a great point to like assume that there's not maliciousness there.
Yeah.
So with nurses on shift, we've kind of talked about our language. We've talked about how we approach people, not putting the burden on our patients to communicate with us. Are there other things that you find like in a medical setting are helpful, um, in this kind of situation that we're talking about, where you maybe, okay, you've come into the room, you've introduced yourself, you've said, how do you like to be referred to? Maybe that person has told you what their pronouns are, maybe they haven't, maybe they've
Mhm.
said, this is my spouse, or this is my partner, this is my friend, whatever language they use. Then are there other things that we can be doing throughout the course of our because, and the reason, to kind of give you an example, sorry, I'm all over the place, I have so many thoughts. But we talk a lot about how for example, if someone's there because they have a sore throat, you don't need to ask them about their genitals. So, I mean, to be really blunt,
Correct.
there might be that curiosity there, but like making sure that our questioning is not out of our own kind of gawking, but is out of like, this is important to your healthcare. And you brought up something in the book that I really liked was the flipping. Can you talk about that? Maybe I'm not using the right term. Hold on. I
Oh
had
yeah,
a
yeah.
book.
The
Yeah,
switch it technique.
switching. Yeah.
Yeah, yeah.
So can you talk a little bit about that?
Oh, sure. Yeah. I mean, I think, especially around what you're talking, I mean, I use the switch it technique for everything. Like, just like, is it
Oh
okay to
yeah.
ask gay people this? I've never once been asked like, well, how do you know you're straight if you've never been with a woman? Like, there's an example of like a question that, a lesbian might get, in the reverse, but when you flip it, it makes no sense. And no one's ever asked me that. But so in this sense around trans bodies, I think, one of the issues is that for some reason people feel like they have the right to ask trans folks very invasive questions about their bodies. And I think it's an even finer line when you're talking about nurses, because they actually are involved in a medical way. So they need to be even more aware of, wait a minute, is this something I actually need to know to help this person with a sore throat or not, and sort of step back. But that sort of in those invasive questions, of course, when you flip it and think about like, what do we ask cisgender people? I think I used the example of like a workplace, like, oh, my wife's thinking, you're at the water fountain. Oh, my wife's thinking about getting a hysterectomy recipe. Hey, Tanya, do you have your uterus? Like, these conversations do not happen in the workplace for cisgender people, but it's not uncommon, believe it or not, even in a workplace, for someone to ask a trans person, like, so are you going to have surgery, right? Which is just, again, I don't know why somehow we think we have a right to ask trans
we're
folks.
so obsessed with like that definition of like what's there versus like
Right.
how do you identify. There's this like, I feel like some people haven't developed their thought, or haven't been exposed enough, or had these conversations enough to realize that I wouldn't ask you that. I wouldn't meet you and be like, so who do
Right.
you have sex with? Like, these are things that I think switching is really important. And, it's true. It applies in all cases. Would you ask this person at the grocery store this question? Would you ask someone that you were hanging out with on a Friday night this question?
Right.
If they're
And
incredibly
actually, you made a great point. I just want to say that I think a lot of the surgery questions and the invasive questions around trans folks is exactly what you're talking about, is that people don't really understand who trans folks are, and that, not every trans person is going to go through this, exact same transitioning process. So I think the mindset is like, kind of like, well, are you done? Have you had the surgery? Have you changed your name legally? Have you blah, blah, blah? When that's not everybody's course. Not everyone wants that who's trans. Not everyone can afford that. I mean, there's all sorts of barriers. And so I think that's part of the problem, is that people really have a misunderstanding about who trans folks are, and just how different, people transition or not, right? And it doesn't make them any more or less trans, or any more or less valid, as people. So I think that really kind of gets at the core of where some of that's coming from. So I really appreciate you bringing that up.
Yeah. And I think it actually, just as we were sitting here, I was reminded of a patient encounter that I hadn't thought about in years. And it's very different, but it made me think of the way patients approach us. So I took care of a woman. I was, it was a women's healthcare clinic. Or I should say a reproductive healthcare clinic. So a lot of the women that we saw were there for birth control, pap smears, gynecological services. And so this woman who came to me once, I don't know where she was from, she was African, and she said to me, I look different than you. And I didn't know what she meant. I was 18, 19 at the time, and I was like, oh, okay, sure. And she was like, no, down there, I look different than you. And what she was trying to tell me was that she had been a victim of female genital mutilation. But she didn't know how to say that to me, because how do you tell someone you just met that's about to look at your body that this is different than maybe what their expectation is. And so while that's a different demographic and a different type of healthcare providing, it just reminded me of how difficult it was for her to even use this coded language to talk to me.
Mm-hmm.
And so let's say we're in a situation where it is relevant to their care. Say I need to put a Foley catheter in this patient. What are some things that I can do as a nurse to make this not only a positive, less traumatic and a positive experience as far as healthcare goes? What do you have ideas for what we can do with that? How we approach those conversations?
Sure. Yeah. And I mean, so now we're really focusing in on a trans individual.
Yes, and I don't mean to get, but also I think that to kind of expand this a little bit, also I think that with healthcare, maybe not a trans individual, but someone who is cisgendered, but maybe I need to talk to them about who their partners are because I'm going to do STI testing or help them decide if they need birth control, which in some, not every female needs birth control. So less, I want to pull the focus back a little bit from trans and just those body conversations that may be difficult for people in a healthcare setting. So does that help a little bit if I kind of bring it back a little?
It is. So I think what I'm going to do is I'm going to back way up and share two of my favorite tips that work really well together, sort of one after the other around when we're talking about respectful communication. Because we kind of went past it, but it's so important. I think it's such a like thing you can use tomorrow or as soon as you shut off this podcast, you can use it. And it has to do with really interacting with everyone and creating those safe spaces and having conversations in a respectful way. And then I will focus a little bit on trans individuals and bodies, because I think that's also like such a great question. So my two tips that work really beautifully together, and I touched on them, but I really want to dive a little bit deeper because I think they're very prevalent, is ungendering language and then mirroring terms. So there are two tips that actually work really well together. So this is sort of backing up to when we're first getting to know a patient. Ungendering language is so critical, and I think we don't always think about what we're doing. So for example, we may be aware to say like, oh, is your spouse going to visit rather than your husband or wife, and making those assumptions. I think a lot of folks are already on board with that. If you're not, that's a great place to start right there. I mean, other than wearing that pin with the rainbow on it, that's like the next best way to let people know that you are open to hearing that their partner is anybody under the sun, right? So that ungender language. But I think oftentimes the kind of place it doesn't come up is we automatically will lady people, like, okay, ladies, or sir and ma'am. And then also when we're talking with children, I think in order to make them feel more comfortable, we'll say things like, oh, like, what a pretty princess, or like, let's go cowboy for the boys, or you've got these little gendered, little nicknames or nice ways that you communicate with them because you're trying to make them feel more comfortable. And I think there are ways to do that without using the gendered terms, because not every little girl is going to want to be a pretty princess, whether they're cis or trans, some girls just are not into the pink frilly dresses. So, like a word like friends, like, come on, friend, like that is as friendly as saying, come on, cowboy.
Hey, folks, how are we doing tonight? Yeah, that kind of thing.
So just sort of being aware, like, are there other words that I can use that will have the same effect to help people feel more comfortable or children feel more comfortable without using these very specific sort of stereotypical gendered words. And then the mirroring terms is the second step, because what happens is, if you say like, oh, well, will your spouse be joining you? Will your spouse be visiting you here? And the person says, let's say it's me, I say, oh yeah, my wife's going to stop by after work. You now want to mirror the term you just heard. So rather than switching back and being like, oh, I should use, I learned, Jeannie taught me to use ungendered terms, I should use spouse. You just got valuable information from that person. They told you that they refer to their loved one as wife. So now you switch and you use wife, and you use that now with that person because that's the term they use. So those two little tips they work really beautifully together. And then sort of just a third, again, very relevant to nursing, is if you actually have had these great conversations and have sleuthed out some information with your amazing detecting, write them in the chart so other people know. And it's especially important around like pronoun use, or if someone's maybe trans, but they're presenting in a way that a lot of folks are misgendering them, make sure you write like, this patient's name is, Georgette, even though it hasn't legally been changed, please refer to her as her, and put that in ideally, eventually, I think we're going to have better forms, which is another topic, where these things are going to be very evident and obvious. And unfortunately, most of the times we don't. It may end up just being a sticky note or whatever, a little note on the side. But if you find out that information, put that down there so
we
other
do
folks can.
we chart in Epic at my hospital, and we have a little nurse to nurse communication board. It looks like a little sticky note that appears on the page, and we use that for folks of whatever identity. His name is Charles, he goes by Buzz. Her name is Judy, she goes by Ellen. Like random things. So we also, I'm very pleased to say that my hospital, when you enter, you got all these check boxes to click. We actually have an entire list of identities that you can choose from. So it's not just male, female, other, because that is such a limiting category. So I would say to people, if you have shared governance at your hospital, if you have committees that help decide what your forms look like, what your charting looks like, try to pull in these inclusive terms. So I encourage people to bring these conversations to committee meetings and to those spaces where decisions are being made. And if you are a straight ally, a cis hetero ally, that's even better, because maybe that person in the room that nobody knows is part of the LGBTQ community. Maybe they're afraid to bring that up, and by you speaking up, you're breaking that shell of insecurity and saying, well, I think this is a great idea. And so I think that's a great way not only to show your allyship, but to then set the example, set the tone for the room. So
forms are so critical, and they are slowly changing, very slowly. I'm still appalled at how many times I get the form and it's got the MF box, and the relationship status is like married, single, divorce, separated.
Widowed.
I'm like, oh my
it's
gosh, and it's, when you think about it, it's often, again, depending on where you're nursing, it's often the first thing that people get. So that, you walk in the door, you get this form, and it's often like sort of a slap in the face, in that I don't fit here. I'm not represented on your form. And it's the first thing they're getting. So we're like, we're stressing patients out with forms that don't fit for them. They're already in a situation where they're like, do I pencil in an other? Do I not answer? So again, we could do a whole podcast on forms, but yes, I think advocacy around forms is critical. One of the things that is not being talked about enough, but I would love to see, is that what often happens is we have the name on top, which tends to be the legal name, and then somewhere down, a little further down, is like nickname or what the person prefers to be called. And the problem with that is, you're going to use that top name. So you walk out and you call someone's name, again, like Emily, and then you're like, Emily? No, Emily. And then you look down and, let's say it's a trans man whose legal name is Emily, but whose name is, Trey. And you're, I mean, Trey, like, you've just outed that person
to an entire waiting room.
The entire waiting room. So like, why are we not having name at the top and then legal name, if different, lower down? Because I know we need legal names for all of the charts and the paperwork, but we are really stressing our patients out by not using the chosen name at the top. And that seems to me such a simple tweak that unfortunately isn't happening. These are all, we're moving into like advocacy stuff, but it's also
but this is all really important, even within the scope of clinics, hospitals, home care. Like, these are, I think, really important things to be thinking about. They're details, and there's probably a million other things that we could talk about, but I really like that we've kind of started with like the most critical basics, and I think that this conversation, I'm hoping, will spark interest in people. Maybe it'll spark some other conversations. I get emails all the time of people saying, thank you for talking about this, because it's so hard to talk about, and now I have something to like instigate a conversation. So I really hope that this is that for a lot of people. Hey, did you hear on Nursing Uncensored? They were talking about LGBTQ allyship this week. You should listen to that. That was a really good episode. And that's not just shameless self-promotion. I really do want to see people like creating space for these conversations among their fellow nurses, nursing assistants, physicians, nurse practitioners, whoever they happen to be. I think this is such valuable information. So we've got this book that you wrote, and if people want it, how do they get it? It's great. It's awesome. There's so
actually,
much.
so can I quickly answer your last question?
Please do. I'm so sorry. I'm so sorry. Yes.
That's okay. And it's very brief. I wanted to just share a few tips on like the trans individual and how to talk about body. Just a few quick tips. So one is that to allow, if possible, the person to have someone with them in the room during an examination. This is sort of like how to make trans folks more comfortable during an examination. So having a friend or a family member in the room is great. Asking the person what they call certain parts of their body. So it can be really sort of triggering for trans folks to use sort of typical so like using the word vagina, for example, for a trans man may be really uncomfortable, and he may have a different name for that. And so using the terms that he's using and referring to those terms in that way can really, really help him. Even something as simple as like a pap smear, to call that a cancer screening is much more comfortable for a trans man who often has to go through a pap smear, right? These are very sort of female-oriented, specific treatments that trans men would have to go through, and it's very much focused on women. So pulling that away and using terms that they use is really important. And then also being aware of that heightened fear by letting that person know that they can pause the exam at any point is also really helpful. Just like, hey, if you need to take a little breather, I mean, obviously it takes more time that you may or may not have, but it's huge. Just letting the person say, oh, can we just stop for a minute? I just need to breathe, or whatever, if it's a little traumatic for them, that's really helpful as well. So anyway, I know I said that really fast, but
no, and that's important. And that's super important. I'm glad that you didn't allow me to just breeze on past that, because that is super important. There's so much that I want to talk about. And, we'll
have to do part 2.
Yes, that would be wonderful.
Okay, so back to my book. Yes,
let's talk about the book. I'm going to bring it up on the screen again.
So thank you. I did have fun with this book. I tried to make it a non-academic read, and what I mean by that is
I hope it's an easy read. It's great.
I hope it's a book that you enjoy reading. I put some fun pop quizzes in it. I tried to make it funny. I think it's funny. Hopefully you will too. The pop quiz.
I love this.
Thank you. Anyway, you can purchase it on Amazon. If you're not a fan of Amazon, you can actually just go to my website, and there's a link to my publishing company, Roman and Littlefield. They sell it directly there as well. And my website is savvyallyaction.com. And I'm actually doing a holiday. So back to my book launch being canceled, my dining room is filled with boxes right now of books that I was going to sell and sign. And so my holiday special is while supplies last. If you actually contact me directly, which you can do from my website, I'm offering signed copies of my book with just the additional shipping fee. So if you'd like a signed copy, there you go. I'm trying to move the stock in my dining room. But,
that's good. And oh, sorry. I just wanted to say I am not one of those people that likes to sit down and read, and I was able to get through several chapters of this just like that. So it's really easy language to consume. It's broken up enough. There's all sorts of interesting little things. And I was reading it more like a reference book than like a front to back. So I don't know that that's how you intended it, but it's even really helpful that way. So I'm excited to have this. So thank you for the book.
Yeah. And then the other thing is also just small bites, easy to learn stuff. I've been having some fun creating little 3-minute videos. So also on my website or on my YouTube channel, which is also called Savvy Ally Action, I create this little, once a month, I create a little fun 3-minute video with ally tips. And nice. those have been getting a lot of hits and have been popular and fun too. Excellent. So
I'll link everything in the show notes and on the website so that people can find you really easily with just like the click of a link. And I would absolutely love to have you back in the future to talk again, because there's, as you can see, I can't contain my questions. There's so much. And I think these conversations are so important. And I really hope that this reaches many people who either maybe haven't ever had these conversations, maybe they do feel uncomfortable. I want to empower them again, like what you said, just take one thing. You don't have to change your entire routine, but take the one thing that you know would be really easy to incorporate into your shift, your assessment, your interactions, whatever, because it could not only make someone feel a lot more comfortable, it can be the thing that saves their life. It can cause them to continue to receive healthcare that they really, really need. So I think this is more than just courtesy. This is about making sure that people can access healthcare that need it, improve the quality of life in general. So excellent. Thank you so much, Jeannie, for being here with me today. I'm really happy that we got to have this conversation.
Me too. Thank you for inviting me. This was fun.
Absolutely. And as I always say, even though you're not a nurse, together we get to wish everybody happy nursing.
Yes. Nurses rock.
Thank you.